Hello, my name is Tim Sarver, and today I'll be discussing the differences in the healthcare systems between South Africa and the United States of America. To start off, I'm just going to discuss the type of health insurance that each of these countries have. So, South Africa has a universal healthcare system, which is provided both publicly and privately. And the goal of their national health insurance is to ensure that all South African citizens have access to quality health insurance. And then in the United States of America, we have sort of a hybrid healthcare system. It's primarily private healthcare because it is publicly financed, but it is delivered privately. And most employers or most insured Americans are insured privately through their employers. Taking a look at life expectancy for these two countries, as you can see from these charts, the United States lives longer by about 15 years on average, and so it's 78.5 compared to 63.6, which is about 14.9 years difference. And then it should be noted that females live longer than males in both of these countries. That is also a global statistic as well, that women are expected to live longer on a global scale than men. And this is due to the fact that women often seek medical attention when they find it necessary compared to men. They don't go to their doctors as regularly. And then males also are involved in adverse health behaviors such as drinking, alcohol abuse, smoking, and poor nutritional decisions. Looking at healthcare spending per capita, the United States spends about 10,209 US dollars per capita, whereas South Africa spends about 1,090 US dollars per capita. Um, these uh, these amounts are in the U.S. It's about 10 times that of what is being spent in South Africa, and I really like this chart because it shows U.S. spends about spends the most money on their healthcare system, and they spend it at a disproportionate rate. So compared to the size of their wealth. Now looking at hospital-acquired infections rate, just to clarify, a hospital-acquired infection is an infection that you get while you're in the hospital that you didn't have before. So looking at the rates of this in South Africa, 1 out of every 10 admissions on average gets a hospital-acquired infection. And then in the US, 1 out of every 31 patients gets a hospital-acquired infection. So this rate is equivalent to 3,225 per 100,000. And South Africa has about 3 times the rate that the United States does. Looking at marijuana usage rates per 100,000 now, I do need to clarify that this chart has lower and upper bounds for estimated number of users annually, and then the percentage of the population aged 15 to 64. In North America, it is the lower and upper bounds are the exact same number, which tells us that this is a very accurate estimate. Um, and so the rate is 10,700 per 100,000. And then in South Africa, the lower bound of the percentage is 3.9% of the population, and the upper bound is 9.8% of the population. So to average this out, it's about 6.8%, which means the rate is 6,850 per 100,000 people regularly use marijuana in South Africa. And then again, looking at these rates, these are relatively similar compared to the vast differences in the healthcare spending per capita. Now, taking a look at air quality, it should be noted that these statistics are from deaths per year due to air pollution, and air pollution is not a common killer in any country in the globe, but it does kill a significant number of people, which I didn't even know about that until I started doing this research. So in the United States, 200,000 people die per year due to air pollution, which comes out to be about 0.061% of the United States population. And then in South Africa, about 20,000 people per year die to air pollution, which equates to 0.035% of the population. Um, and these rates are also pretty similar in comparison when comparing to the wide differences in some of the other factors that I've looked at. Now, taking a quick look at uninsured adults, um, the rate of uninsured adults. So in the United States, 91.2% of adults are insured. That means they have insurance in some type of way. So that means only 8.8% of adults in America are uninsured, which means the rate per 100,000 Americans is 8,800. And then in South Africa is very different. So only 17.4% of the population is insured, and then which means 82.6% of the population is uninsured. Um, and so that leaves the rate at about 82,600 per 100,000. And as you can see, this is about 10 times the rate of the United States. Now taking a look at the unemployment rates for both of these countries. To start off, the South Africa rate, the rate in South Africa is 27,100 per 100,000, and then the U.S. is 3,800 per 100,000. And I really like this graph. Just let me clarify this graph. So this blue line is the U.S. unemployment rate, and back in 2009, it started at about 8 per 100,000, and it has slowly decreased to now in 2019. If you follow this across, we're at about 3.8% or 3,800 per 100,000. And then taking a look at South Africa, South Africa started back in 2009 at about 23, and it has slowly, gradually increased over time. And now they're sitting at about 27,100 per 100,000 who are unemployed. And and then looking at these numbers, South Africa has a rate that is about 7 times more than the United States of unemployed adults. To conclude my presentation, I'd like to say that I think, based off what I've found, the United States has a better healthcare system, and it seems to be working better. Um, Although they spend 10 times more money in the US on healthcare, it seems to be paying off because they are living about 15 years longer. Um, they also have less hospital-acquired infections because South Africa has a rate that is 3 times more than the US's rate. Um, Even though marijuana and deaths to air pollution are similar for both of these countries, I think just bringing those statistics to attention is very important in trying to prevent deaths from these throughout the years in the future. And then taking a look at uninsured adults and unemployment rate, the uninsured adult rate is 10 times that in South Africa than in the United States. Looking at these numbers, it's 82,000 compared to 8,800. And then looking at the unemployment rate in South Africa compared to the United States, um, South Africa has a rate that is 7 times more than the United States does. And as I've stated before, I think the United States does seem to have a better healthcare system that is working well, even though they are spending about 10 times more money on healthcare than South Africa is. Thank you.